Hello everyone, welcome back to the channel. In this video, we'll be discussing about the chapter 4 of surgery, which is infectious disease. In this video, we'll be mainly discussing about the surgical site of infection. What is surgical site of infection? Wound infection which occurs within 30 days of surgery or if an implant is placed within 1 year of surgery is known as surgical site infection. This infection is the second most common complication following a surgery. The first one being the post-operative pneumonia. So surgical site infection is the second most complication following in surgery. What are the sources of infection and the organism which causes this surgical site infection? The organism which causes surgical site infection is the Staphylococcus group of organism, and the sources could be the sputum, urine or the feces of the patient, or from the OT which has no proper ventilation, the surgical wards, wounds, ulcers or any catheters which are placed and the drains which are placed to the patient. These are the organism and the sources of infection for SSI, that is surgical site infection. The risk factors for surgical site infections are the extremities of age, either the neonate or the older adults, any recent surgery involving the chest or the abdomen, if the patient has any coexisting infection, or type 2 diabetes mellitus, and if the patient is on corticosteroid therapy, hypoxemia, if the patient is obese, malnutrition, chronic inflammation, any prior site irradiation has taken place, or hypothermia. These are the risk factors for SSIs. The factors affecting SSI are the bacterial entry, the bacterial virulence, the microenvironment, and how is the host defense. The bacterial entry can occur through the air in the OT, instruments which is placed in the OT, or from the staff. These are exogenous factors involving SSI, or endogenous, which are perineum, urine of the patient. Secondly, the bacterial virulence, and then comes the microenvironment, which is the patient's HB and any foreign bodies present in the patient's wound. Then comes the host defense. If the patient is on corticosteroid therapy, same like the ones of risk factors, either the patient is on type 2 diabetes mellitus, having any coexisting infection, if the patient is obese, all these comes under host defense. SSI involves certain sequence of events, which is activation of inflammation, which has phase 1 and phase 2. Phase 1 is only vasodilation and increase in the vascularity. Phase 2 involves phagocytic infiltration. Once the phagocytes infiltrate, there is release of pro-inflammatory cells, further leading to signs of inflammation which is rubor, calor, dolor, tumor and loss of function. This is all about the introduction part of SSIs. Firstly, you will be writing the definition of surgical site infection, then what is the organism which causes SSIs, the sources of infection, risk factors and factors affecting SSIs, and then at last comes the sequence of events. What is the classification of SSI? This is important. SSIs are being classified based on the depth, etiology, the time involved and the severity. Based on the depth, it can be superficial infection, deep or organ space. Superficial is just the involvement of skin and the subcutaneous tissue. Deep, wherein the deep tissues are involved, and organ space, it can be the thorax, abdomen, peritoneal cavity, etc. Based on the etiology, it can be the primary surgical site infection or secondary to certain complication. Or the time. Based on time, it is classified into early, intermediate and the late. Early is within 30 days, intermediate is within 1 month to 3 months and late is by 3 months, that is more than 3 months. Based on the severity, SSIs are classified into minor and major SSI. Minor SSIs just involves discharge without any cellulitis, but major will have dehiscence of the deeper structures. This is the classification of SSI based on depth, etiology, time and severity. The surgical wounds are also classified into clean wounds, clean contaminated wounds and the dirty wounds. What are these? Clean wounds are those wounds which are done during surgery, that is surgical incision. They are elective wounds and they are primary closed. They do not have any break in the sterile technique. The examples are any clean incised wound, Surgeries like thyroid or breast surgery and CABG. CABG means coronary artery bypass graft surgery, which is done for heart surgeries. Secondly, there is clean contaminated wounds. Here, there is controlled opening of normally colonized body cavities. Clean contaminated wounds are generally seen in elective surgeries. There is minimal spillage or break in the sterile technique. Examples involve the gastrointestinal and genitourinary system. These are usually without any inflammation. Examples are elective cholecystectomy, appendectomy, LSCS surgery, that is lower segment C-section, and abdominal hysterectomy. Thirdly is the contaminated wounds. These are usually seen in emergency surgeries like emergency cholecystectomy, appendectomy, or any intestinal obstruction. They show acute inflammation and there is spillage from the hollow organs. At last come the dirty wounds wherein the pus is present. Examples are purulent abscess, necrotizing fasciitis, perforation with a colonized bacteria. This is all about the classification of surgical wounds, which is clean wound, clean contaminated wounds, contaminated, and then at last comes the dirty wounds. For a surgical site infection, there is a criteria for wound score. One is the asepsis score, the second one is the grading, which is the Southampton's wound score. Firstly, the asepsis score. This is same as the derivation of asepsis. It involves the first letters of asepsis A, S, E, P, S, I, S. A stands for additional treatment. If the antibiotics for wound infections are required, drainage of the pus is needed, or wound debridement is needed. This is additional treatment for asepsis score. S stands for serous discharge, E for erythema, P for purulent exudate, and if separation of the deep tissues are occurring, that is for S, isolation of bacteria from the wound, and then at last comes the stay as inpatient for more than 14 days. All these things are graded using numbers and then at last a score will be done. No need to remember the numbers, just by remembering the first letter of asepsis score is enough. The second one is grading of surgical site infection, which is Southampton wound score. This grading involves 0 to 5. 0 is normal healing, then comes normal healing with mild bruising and erythema. The next one is having severe erythema with other signs of inflammation. Grade 3 is for clear or hemoserous discharge. Grade 4 is for purulent discharge, and then at last the grade 5 is having severe wound infection. This is all about wound score, which involves asepsis score and Southampton's grading of wound score. There are certain definitions for SSIs. This is important. Firstly, you remember how the wound progresses. Firstly, bacteria is present on the wound surface, but there won't be any division of the bacteria. Then the bacteria starts dividing, after which the bacteria invades the wound surface and there can be presence of biofilm. Then the bacteria invades the local tissues, then the surrounding tissue, and then at last the bloodstream. The definition for these are as follows. When the bacteria invades the wound surface without any division, it's called contamination. When the bacteria starts dividing, it is called colonization. When the bacteria invades the wound surface with the presence of biofilm, it is called topical infection. But when the bacteria invades the local tissue, it is called local infection. When the bacteria invades the surrounding tissue, they are called spreading infection, regional infection, or cellulitis. Cellulitis will be dealing it in the second part of this video. Then at last it invades the bloodstream, then it is called sepsis, further leading to septic shock. So the definitions are contamination, colonization, topical infection, local infection, regional or spreading infection, which is cellulitis, and then at last comes the sepsis and then the septic shock. The prevention of surgical site infection involves 4 headings: the preoperative, care in the OT, antibiotic therapy, and enhancement of the host defense. Preoperatively, hand hygiene also plays a very important role. Firstly, there should not be any prolonged pre-op admission. So the prolonged pre-op admission should be avoided. The surgical site should be shaved or clipped. This will decrease the chances of SSIs. Selective shaving will be needed for scalp, axilla, groin, and perineum. cleaning and antiseptic scrub of the surgical site. Then the patient should be treated for any obvious infection. Surgery is postponed if the hand or fingers of the surgeon is infected. Then comes the care in the OT. Sterile techniques should be involved in care in the OT. The staff should use sterile caps, masks, sterile gowns, and sterile gloves. There should be sterile OT and instruments. Thirdly, antibiotic therapy should be administered close to the time of incision, and post-op systemic antibiotics for 24 hours should be administered. And then at last comes the enhancement of host defense. Here, we'll be monitoring the temperature of the patient and keep the patient warm. This helps in resisting the bacteria. Deliver oxygen in order to maintain a aerobic medium. And then the blood glucose should be in control. Lastly, the management of SSIs. It depends on the type of SSI. Wound debridement can be done. Sutures are removed for free drainage of the pus. Culture and sensitivity for that specific antibiotics will be given. If the healthy granulation is formed, secondary suturing will be done. Then it heals by scarring. This is all about the management of SSIs. Let us revise it once. Firstly, we started with surgical site infections definition, which is the second most complication of any surgery. What is the organism and source of infection? The risk factors and factors affecting SSIs. Then we talked about the sequence of events involved in SSIs. Then the classification of SSI based on the depth, etiology, time and severity. Then the classification of surgical wounds into clean wound, clean contaminated and dirty wounds. The criteria for SSIs, that is for the wound score, which involves the asepsis score and the grading by Southampton's wound score grading. Then we saw certain definitions for SSIs. Then the prevention of SSI, which involves preoperative care, care in the OT, antibiotic therapy, enhancement of the host defense, and then at last the management of SSI. This is all about surgical site infection. We will be continuing the chapter of infections in surgery in the next two videos. Thank you for watching.